Welcome to Go Vote Omaha, presented by the League of Women Voters of Greater Omaha. I'm Jerry Simon, a League member and your host. Each program we talk about important public policy issues. We hope you'll discuss those same issues, and then at election time you'll be ready and willing to go vote. This time we're going to be talking about expanding Medicaid in Nebraska, and our guest to talk about Medicaid is Molly McCleery. She's the Deputy Director and Staff Attorney for the Healthcare Program with Nebraska Appleseed. Welcome, Molly.
Thanks, Jerry.
Thanks for being here.
Yes.
Well, tell our viewers a little bit, for those who might not know about Nebraska Appleseed and what you do for the state and for our citizens. Tell us about Nebraska Appleseed.
So Nebraska Appleseed is a nonprofit legal advocacy organization that fights for justice and opportunity for all Nebraskans. We work in 4 program areas. We have healthcare access, which we're going to talk about tonight,
Right.
Child welfare, which works with children and families who are impacted by the foster care system, immigration policy, and economic justice, which really looks at poverty and alleviating poverty across our state. We have folks on staff who are community organizers who work out in the community. We have lawyers, and we also have policy expertise as well. So.
Okay, and the League of Women Voters often works with Appleseed. We want to say right up front that we are definitely working on helping to expand. We support expansion of Medicaid, and so we are working with Appleseed on this particular issue too. Well, there have been several attempts to expand Medicaid since the Affordable Care Act in the unicameral, but those have failed. So now there's a different tack that we're taking, and that is to get it on the ballot so that people can vote on whether to expand it in the state of Nebraska. And that's the Insure the Good Life campaign, and we have a logo for that particular campaign we're going to throw up on the screen for people to see so they will recognize it. Talk about this new approach. Why was this the decision made to go with a ballot initiative?
So we have had 6 attempts in the legislature to pass Medicaid expansion, and all different sort of flavors of Medicaid expansion, from the simplest, just providing that health care, to incorporating things like premiums in the private market, and none of them were able to get over the finish line. What we noticed, though, was talking to voters was a lot different than talking to policymakers, that voters understand the issue and care about the issue. And all along, we have about 90,000 Nebraskans who still lack health insurance. This summer, after all of the attempts to repeal the Affordable Care Act, the understanding of this issue and the understanding of the importance of health insurance really came to light. And then this fall, after Maine was able to put Medicaid expansion on the ballot and pass their initiative, we felt like it was the right time to move forward with this here. So that's why we're taking it to the people and taking it to the ballot.
Okay. Well, in order to get it on the ballot for November, you need to get enough signatures. So talk about that process and what is needed to actually get it on the ballot.
So we need 85,000 signatures, which represent, or roughly 85,000 signatures, which represent 7% of registered voters in the state. Of those 85,000 signatures, there has to be 5% of registered voters that sign in 38 of the counties. So you have to have signatures from all across the state, not just in our urban areas.
Okay, and the deadline, those have to be collected actually fairly in a short time frame. So when's the deadline for collecting signatures?
The deadline for that is July 5th, so that's
Okay.
4 months before the November election.
Okay, and then Secretary of State's office will validate the signatures, or the county election commissions? How does that work in terms of validation?
Yeah, so the Secretary of State's office receives all of them, and then they work with the county clerks and county election commissioners to verify the signatures with the voter registration files.
And you must be a registered voter to be able to sign the petition.
Yes, so when folks are out circulating petitions, they'll ask if you're a registered voter first, and then ask if what county you're registered in, because that county's clerk or election commissioner will have to verify that you are indeed registered in that county.
Okay. And how are we doing? How is it going, the campaign to get enough signatures?
It's going really well. The positive of having 6 legislative attempts and not being able to pass it through the legislature is that the voters are really engaged and understand what the issue is. So it's a lot different than the first year we were attempting to pass it to the legislature and having to do a lot of explaining. And when our circulators are out in communities asking people if they want to sign the petition, most people know what the issue is and have an opinion one way or the other, which is exciting. Or just asking people, do you think that people who make under $17,000 a year should have health insurance? Most people are saying yes. So that's really been encouraging.
Okay. Well, for those viewers who may not know, talk a little bit about what Medicaid is and what it covers and why is it important for Nebraska. I mean, you mentioned already we have 90,000 people who don't have health care coverage. So talk a little bit about what goes into Medicaid. What does it cover?
So traditional Medicaid covers 5 main groups of people. So it covers children, so about 2/3, we have 235,000 roughly Nebraskans who currently receive Medicaid, and 2/3 of those are kids. There's also seniors or people over 65, folks with disabilities, pregnant women, and then some very, very low income parents. It's around making around $1,000 a month for a family of 3 is the top threshold that you can make as a parent and be eligible for Medicaid. It's the highest payer for long-term care. It provides a lot of care for children in schools and is really a stable source of insurance for a lot of people in our state. At the same time, we have 90,000 people who aren't eligible for Medicaid but aren't eligible for private insurance coverage either. So those fall into 2 main groups. We have parents who make over that $1,000 a month threshold, but that making over that amount is not enough to get tax credits or subsidies on the marketplace to make insurance in the private market affordable. So it's that making too much for Medicaid but not enough for the exchange. And then childless adults are never eligible for Medicaid. So if you are just a single childless adult, no matter what your income is, you can't be eligible for Medicaid under our current system. So those are the 2 groups that would really be picked up by this option.
Okay. So in terms of the expansion, the Insure the Good Life campaign really has, you've got 4 priorities. And so we have a graphic to throw up on the screen for people to see what those are. And why don't you go through those 4 and explain each one of them for our viewers?
So the first one is to expand health insurance to people who make under $17,000 a year. So if you run the number on expanding coverage to up to 138% of the federal poverty level, which is what this option would do. No one speaks in federal poverty levels. That's not how people normally talk.
Right.
So if you run the numbers for a single adult, it's about $17,000 a year or below.
Okay. And that's below minimum wage in Nebraska too.
It's
a little bit.
It's right. Yeah, it's right around there. So if you are working, we know that most people in the coverage gap are working. They're just working in jobs that don't provide insurance. So working in places like retail, restaurants, construction, a lot of home health aides. So as our population gets older and we need more home health support, those are often jobs that don't provide a lot of benefits. And so this would be, that's actually our second priority is providing health care for folks who are working that just are in jobs that don't have those benefits. The third priority is to bring back our federal tax dollars. So Medicaid expansion is funded at a 90-10 match. So normal Medicaid is paid 60% roughly for Nebraska by the federal government and 40% by the state. It's based on this formula that changes every year depending on how a state's economy is functioning. So a state who has a better economy gets less federal funding. A state who is not doing so well economically gets more federal funding. The Medicaid expansion match is around 90% federally funded and 10% on the state. The state would be at most required to pay 10%. We are already paying for this through tax dollars. The ACA was set up so that it was paid for through a mix of taxes and cuts to federal spending. And so we could, through that 90% federal match, bring back about $1 billion in tax dollars that we're already paying.
And so the money is there. It's just that we're accessing it.
Yes.
So, okay.
And the last piece that is really important with Medicaid expansion is through bringing back those tax dollars and providing a payment source for folks who are uninsured, we can both grow and sustain existing jobs, a lot of which are in the healthcare field. If you think about some of our rural communities, healthcare providers are the top employers in those communities. So by ensuring that people who are going to receive care in those facilities have a payment source through insurance, we're able to bolster those jobs and sustain them, and then also add additional revenue to those facilities. There was a study done the first year that we did the Medicaid expansion effort through the legislature that said we could add and sustain $10,000 jobs to our economy through Medicaid expansion.
Okay. And one other thing that I think people often want to know is, if someone on Medicaid, do they pay anything toward their health care costs? Are there any co-pays or anything like that that they must cover as well?
It depends on what sort of category the person fits into. So obviously a child is not going to pay co-pays, but for a number of services, there are co-pays and costs to receiving some services. It's not the monthly premium structure that you see in private insurance, but there is a lot of times something that an individual has to pay.
Okay, so for anyone saying this is giving people a free ride, there are costs that they are responsible for helping to cover. A part of that. Okay. Well, let's talk about Nebraska and comparing us to other states. We have a graphic to put up there that also to show, which is that since 2014, when the Affordable Care Act went into effect and Medicaid could be expanded, that was offered for states, we have 33 states that have expanded Medicaid. And two of them are our neighboring states, Colorado and Iowa. And soon Virginia is going to, last couple of days we've heard, is going to expand. What can we learn from our neighbors and from those states that have expanded Medicaid, and why is that significant for, or should it be for Nebraska?
So one of the main things to remember about health care in our state is that a lot of the services that would be picked up through Medicaid expansion are things that we're already paying for. So we already have a considerable behavioral health budget in our state. We pay for services for a number of different populations through our state budget, in public health programs, in county budgets, all of which would be sort of absorbed through that 90% federal funding. So states that have expanded Medicaid have seen that there are a lot of programs they're paying for out of state funds that are able to be offset by this federal funding, and that can either be cost savings or be funds that are reinvested into other areas. One of the big areas that we see a lot of savings from other states is corrections. And so we know right now we have a corrections overcrowding issue in our state, and one way that this has been studied is to show that by providing folks that are leaving correctional facilities with a consistent source of treatment and being able to continue the health services that they have received in corrections institutions, that there's a less of a chance of them reoffending. And so that can save both sort of the human cost of people cycling in and out, but also save a lot of money. We have also seen that just generally state healthcare costs have grown at a slower rate in states that have expanded Medicaid, because they do have that infusion of federal dollars that they're able to sort of maximize their spending.
And there actually, from what I'm remembering, there's actually been some savings in our Nebraska budget, in the Medicaid budget. It's actually gone down a little bit, hasn't it, in terms of our Medicaid spending as it is?
It's held pretty steady, actually.
Okay.
It's grown at, if you look at the Medicaid spending as compared to what private spending on health insurance or health care generally looks like, our Medicaid grows at a slower rate and is held pretty steady over the last decade or so. We do have a new managed care system that is where essentially the state contracts with private insurance companies to administer Medicaid. And one of the touted benefits of that is that it should be able to create some efficiencies and create some cost savings. And so that's one thing that the state is watching for as well.
Okay. So we're with a bunch of states that have not expanded Medicaid. So what can we learn from the other states, our cohorts, in not expanding Medicaid? What lessons are there from not expanding?
So we're really missing out on that federal funding and being able to invest that back in our communities. A really good example of what we're missing out on is what they've seen in Montana, which is a state that did expand. They recently had an independent economic analysis done of what revenue growth they've seen through expanding Medicaid, and had the outcome of that reporting was that it essentially paid for itself through both the cost savings, but then also job creation, fewer bankruptcies, things like that. There's a number of different ways that having access to health insurance impacts our state, both through just the individual source of coverage, but also when parents are able to have coverage, their children have better outcomes, both in their health and then educational outcomes. When people aren't filing for bankruptcies, then Main Street in your community has more money that's going into it. People who have extra money in our towns they're spending it in their towns.
Right.
So there's a lot of different ways that this impacts that we're sort of missing out on by not expanding.
So you're really saying there's economic development that happens because of Medicaid expansion?
Yes.
Okay, with the spending of dollars. Okay. And I guess one thing that people always want to know when you'd say, well, we want to expand Medicaid, a question would be, isn't this going to increase my taxes? So how do you answer that particular question?
So it's tax dollars, that 90% federal funding is tax dollars that we're already paying. So that's not new taxes, it's taxes that we're already paying.
Okay.
There's also, if you look at the areas across our state budget where we're already spending on health for the population that's covered under Medicaid expansion, there's a considerable amount of money that we're already spending that would either be saved or repurposed in different areas of our state economy. So, there's a number of different ways to sort of answer that question, but I think the biggest thing to think about is that when people don't have health insurance, it's not like people stop using healthcare services. We just provide them in really inefficient ways, and our state is not as healthy as it could be. So when people can't get preventive medicine, we end up paying for that as a state in the long term through more expensive interventions.
Okay. And we know that I was going to talk about who opposes expansion. We know the governor opposes expansion and has. And is there any other organized groups that we know of right now that are opposing expanding Medicaid, or?
At this point, in terms of opposing the ballot initiative, we haven't seen organized opposition. I'm sure that there will be, but we're still sort of early in the collection phase.
Okay. I know that in opposing Medicaid expansion, I think it was the governor and maybe some other legislators too, say, well, that federal money's going to dry up. But the federal government has consistently been funding Medicaid as it is. How do is that a real prospect that the expansion money is going to go away, and that we would be left having to cover that expansion with state funds rather than federal?
So that argument doesn't hold a lot of weight for a number of reasons.
Okay.
The first one is that this Medicaid expansion option is written into federal statute, which would have to be changed if they were to stop funding this program. We saw this last summer that in attempting to repeal the Affordable Care Act, that Medicaid and Medicaid expansion were the big sticking points that states who have expanded Medicaid were opposing modifying Medicaid expansion or Medicaid generally because of the benefits that they brought to their state. So the likelihood of that being changed seems pretty low. Additionally, we don't sort of apply this test of will the federal government back out of its promises to any other part of our state budget. So why are we doing it for this program? If this were a 90% match for roads, ag, education, anything like that, we would be wanting to take it up, but we're applying a different test to providing healthcare to low-income Nebraskans. If you look at our state budget, for the past fiscal year, about a quarter of our budget was federal funding. And some programs are funded at an even higher rate. That's just sort of the average across our state budget. So that's not an argument that we apply equally across the board.
Okay. Besides the League of Women Voters, you've got a lot of other partners or organizations that are also supporting expansion. So can you talk a little bit about who the other groups are that are helping to support expansion of Medicaid?
So there are a number of different groups that have signed on, and if you go to the Insure the Good Life website, there's a list under the Our Fight tab that shows sort of an up-to-the-minute list of endorsements, including League of Women Voters and Nebraska Appleseed. But there's also other groups that include faith groups, healthcare provider groups, groups like Planned Parenthood, other advocacy groups like Voices for Children. So there's a pretty broad mix of groups that support this, both groups that would see both the clients that they serve directly benefiting from it, and then other groups who see the intersection with the issues that they're working on. So.
Okay, great. I think sometimes it seems like it helps people to understand need for something like Medicaid expansion better if they have an example. Like so do you have any stories or personal tales that you can tell us about anyone that makes sense in terms of expanding Medicaid?
Yeah, so I can kind of start with some facts first and then apply a story to it. But I mentioned earlier that we know that most people in the coverage gap are working, and we know the jobs that they're working. So we know that the top occupations for folks in the gap are food service, retail, service industry jobs like barbers and hairstylists and home health care. And so these are folks that we know in our community. They're the people that when you go buy your morning coffee, they're the person giving you your coffee or the person bagging your groceries. They're the person who is helping take care of your children as a para in schools, all sorts of things. And so we work with a lot of people who are impacted by this, and they range from people who have started their own businesses and as everyone in the mid-2000s and in 2008 felt that recession really hard, had to change how they were doing things, and were less able to provide insurance as an entrepreneur. A lot of folks who are parents that are working hard, working full-time, just trying to make ends meet. There are a number of people who have pretty significant illnesses, but they don't qualify for disability. And so if they were able to get sort of that preventive care, that care to maintain their health, they would be able to work more hours and potentially work in a field that would provide benefits, but are sort of kept at this level where they're not able to do that. So. Yeah, there's a lot of different people. It's an urban problem, it's a rural problem, it's a problem in all of our communities.
So really, you could look around your neighborhood at neighbors and anyone who is serving you or you're working with, and there might be people who really need Medicaid for covering their health care.
Yeah, and I think there's a misconception of who uses Medicaid, and in that's not an accurate perception. And we learned that a lot this summer in talking about the Affordable Care Act, but I think especially this sort of adult population, there's a misconception. It's people who are working hard. It's just there are a lot of jobs, especially in our rural areas, that don't provide benefits. So you can work full time and not be able to make ends meet. So
right, and not be able to buy insurance yourself on the exchange because you still don't make enough money. Okay. Well, if the proposal to expand Medicaid for some reason doesn't get on the ballot, or if it does but it fails, what will happen?
So the need doesn't go away if this doesn't pass. I think it will get onto the ballot and it will pass, but there will still be people who need coverage and need health care. And we have sort of a patchwork of safety net facilities in our state that picks up the need, but the need doesn't go away, and a lot of the facilities are not able to provide sort of that comprehensive care. So there will be a need that we'll have to figure out how to meet, but this is the best option that we have at this point to cover these people. Okay.
And I think you mentioned also there are several other states that are looking at expanding with a ballot proposal this year, or do you mention those?
So Idaho and Utah they have gotten enough signatures that this will be on the ballot for November. Montana had passed Medicaid expansion through their legislature, but put a sunset provision on it, so it will be they're collecting signatures to make it permanent. We could be on the ballot in November, so there's 4 states that
Right.
are on the cusp of doing it that way. And then, as you mentioned, Virginia, as of yesterday,
Yes.
could be the next state. So.
Right, okay. Any changes that looking ahead to the next term in the unicameral, do we see anything that we think the unicameral might try to change in terms of Medicaid? There are some states that are looking at different kinds of waivers for their programs, including requiring work requirements. Do we see anything like that on the horizon for Nebraska?
It's something that we're monitoring closely because a lot of states are looking at it. At this point, the real drawback, well, there's a number of drawbacks, but for individuals, it's a lot of these waivers that are being proposed are problematic in that they reduce access to coverage and make it very difficult for people to maintain coverage. But also at a state level, it's very expensive to implement any of these programs. So if you are requiring people to work or to submit paperwork or do all these things, you have to have state staff that checks that. Mm-hmm. So we would have to have a way to pay for that. And so that's something that would have to be discussed.
Okay. Well, if someone wants to sign the petition to expand Medicaid, they have it. Where can they do that?
So any sort of community event, there should be somebody out collecting signatures. So at farmers markets, at summer festivals. There are also opportunities in Lincoln and Omaha to drop by the Nebraska Appleseed office to just sign the petition, or to drop by a couple coffee shops in Omaha where we have someone sort of stationed there. If you go to our Twitter feed or our Facebook feed for Nebraska Appleseed, they have the times and dates of when people will be out. Also, you can just contact our office and we will find a way to get you a petition. If you're interested in circulating a petition to your friends or your families or your coworkers, that's something that we can help with as well too. Okay,
that sounds really good. Well, thank you for being a guest and talking about Medicaid expansion. We're hoping we're going to see it on the ballot, yes. And maybe we'll talk again in the fall when that is on the ballot for voters. So for the League of Women Voters, I'm Jerry Simon, reminding you to inform yourself about the issues, and at election time, go vote, Omaha.